Hello, welcome to Joy in Our Town. I'm Cheri Duckworth, and joining me today is Dr. David Farmer. He is a program director at UNT's Health Science Center for the Reynolds Geriatric Education and Training in Texas and the Get It program.
That's right.
Wonderful. That's a mouthful. Can you tell us a little bit about what that's about?
Well, it's our goal is to train physicians in treating geriatric patients.
Wonderful.
And so we work with medical students, residents, as well as practicing physicians.
Now, when I talked with you before we started today, I told you about a personal situation I had with a grandmother who's almost 100 years old and looking for a physician that specializes in geriatrics was a challenge when she came into the Metroplex. Can you tell us a little bit about why this is a challenge and where medicine is going right now with geriatric care?
Well, you know, we're concerned about several things. You probably have heard terms like the grain of America or baby boomers.
Yes.
And, you know, we're really concerned because those Americans that were born between 1946 and 1964 are the baby boomers. And this is a large group. It's about 78 million people. And what's begun to happen in 2011, they begin to reach retirement age. So the population of America is growing older, and we're living longer.
Yes.
And so, you know, so that's what we talk about, the grain of America. And at the same time that that's happening, you know, the ideal physician for an older person to see, one of those persons 65 and above, would be what we call a geriatrician. Geriatrician is a doctor that specializes in treating the unique healthcare needs of older adults. And so the problem comes in that we have this 78 million Americans who are aging, and we only have about 7,000 geriatricians in America. Now, that's out of about 700,000 physicians. And so that probably speaks to the difficulty, Cheri, that you were sharing with me about finding someone to work with your grandmom who specializes in treating older adults.
Absolutely. Now, we also, you mentioned a moment ago, the health issues that face those that are 65 and above. What are some important issues that you would say this aging population faces that's unique to this particular age group?
You know, one of the most unique characteristics for this age group is what we call comorbidities, which really means that they have multiple problems. A person might have diabetes and hypertension, maybe musculoskeletal problems, arthritis, difficulty sleeping, and so they have multiple problems that are being dealt with. Often what happens then is they're seeing several different doctors. And in the midst of that, another concern develops in what we call polypharmacy. They end up taking many medications. And one of the unique problems that we see for older adults is that often there's not one person who's reconciling those medications or looking back over those medications periodically to make sure, do they still need to be on these or not, these medications, or do there need to be medication changes? As we grow older, also our body handles the medication differently. And so it's important if you're using all these medications, certainly to have someone who's watching for interactions between them or other complications that the medications might create.
And that's a huge fear, especially with a long list of medications. And if you go to see another physician and they give you another prescription, how do you know that it's not going to have a negative interaction?
Right.
So finding that one physician that you know is going to watch all of that is so important.
Yes. And in light of the numbers I was sharing with you, you know, we're lucky in a large metroplex because often there are greater concentrations. But when you look nationally, there just aren't enough. And particularly if you're in a rural community, in rural communities, it may be much more difficult to find a physician who's specializing in geriatrics.
It's definitely much more challenging. When it comes to baby boomers, and I like this, the sandwich generation, I think you're going to have to educate me there and tell me what that is. And then, of course, the grain of America. How can we address these particular groups of people?
Well, in the sandwich generation, which is kind of a funny term, right?
Yes.
You think it's not just that we enjoy sandwiches, eating sandwiches, but they're really stuck between. They're typically the adults in America, typically in midlife, who are dealing with their aging parents, as well as they still have responsibility for their children. They may be young children, or they may be in college or just out of college. And so it's this group of adults who are trying to figure out how to best manage dealing with their children and their parents at the same time. And so often they're dealing with this grain of America in that they're trying to make sure that their parents have adequate and appropriate health care.
And that's much more popular these days. I see a lot of that where there's parents who are sending their kids off to college, but at the same time, they're trying to take care of their aging parents and trying to balance both out.
Oh, yeah. And so we deal a lot. The interesting thing about geriatrics is that often it's a team approach. In medicine, it's a team approach. You'll have a geriatrician. Certainly, you may have a social worker working as well to help the family be aware of the resources that are available to them and to kind of talk through the treatment and management plan with them.
Now, obviously looking for the right physician is going to sometimes be a challenge, but how can we make that easier for those who are watching today who are in that situation? What are some things that they can look for, questions they can ask to help narrow it down?
Well, I think certainly the ideal situation would be to identify someone who is fellowship trained in geriatrics, which means that they've had at least a year or more of specialized training in working with older adults. That typically happens after their residency program is complete. The other would be finding a board-certified geriatrician. Now, the problem again goes back to those numbers, about 7,000 geriatricians. And so there are other physicians, primary care doctors, and others out there who, through experience in working with older adults or through their own continuing education, have become more accustomed and trained in working with older adults. One thing I'd like to tell you a little bit about is some of the things that we're trying to do to help with this problem when it comes to medical education.
Okay, now when it comes to getting a good referral, is there anywhere that they could go to just to get started on their search?
You know, I think asking, certainly, certainly you can always go to the internet or to the phone book. I'm not sure if anybody's using phone books anymore, but to the internet at least.
What's that?
Yeah. And you certainly can look for those who advertise that they're specializing in geriatrics. In almost every community, there are senior citizen services organizations that certainly could help make those referrals, or even other groups like the Alzheimer's Association. So for those out in communities with senior citizen services or other senior citizen organizations,
it's a good place to start.
It's a good place to start. They often can make referrals back into those geriatricians or those who are accustomed to working with older adults.
Such a practical idea. It makes you go, oh, why didn't I think of that?
Right.
I like that. That's good. When it comes to medical schools right now addressing the shortage of geriatricians and meeting the needs of a growing aging population, what is being done about that?
There's been a movement, there's been a concern, because historically, in medical school training, there was not a lot of emphasis on geriatrics, on aging, just because there's so much that these future doctors have to learn. And so there's been a movement, concerns have arisen because of this demographic, this aging demographic that I was sharing with you. And so what we've begun to do, one of the things that our university has done and many other universities across the country, medical schools are doing, is we're developing programs like the Get It program, the Geriatrics Education and Training in Texas program. And what we're trying to do is we're working with our medical school, the Texas College of Osteopathic Medicine, and we've begun to integrate geriatrics training beginning in year 1 of medical school, going all the way through year 4, and then with residents as well.
I think it's interesting that this is becoming an issue. It's a challenge that we're facing, but what a wonderful challenge that we're facing, that people are living longer. What would you say from your personal assessment is causing this to occur, where people are living longer nowadays than they used to in the past?
Advances in healthcare and access to healthcare, plus just information. One of the things we're concerned about is education. How do you take care of yourself? We know so much more about diet now and the role of exercise. And so we're getting word out there, and what's amazing, what our students are learning is, because often they come in with a mindset that older adults in their 70s and 80s, in their mind they're thinking these are frail older adults who are at home. And what they're discovering is that actually they're quite active. They're out, they have lives of their own, they have activities they're involved in, and they're very busy in their own lives. So, I think certainly exercise, health, nutrition, just being aware that we do have the potential to live longer, so it's very important across life to take good care of ourselves.
It's wonderful to hear that, and it's wonderful to hear that there are so many advances and people are so much more educated on their health and living longer. And what a wonderful what a wonderful challenge to have in our society these
Yeah.
days. And it's great to hear that it's also opening up a whole new area for our future physicians to
Right.
specialize in as
Yeah.
well.
You know, one of the programs that we're using it's pretty an interesting, innovative program is a program called SAGE, Seniors Assisting in Geriatrics Education. And actually what we do is we require all of our first and second year medical students to be paired. They're put in twos, and they're paired up with a senior adult in the community.
Oh, that's wonderful.
And they make home visits with a senior adult. And it allows the students to practice the clinical skills that they're learning, taking blood pressure and listening to their hearts and noticing changes in their skin and doing cognitive assessments. And the senior adults get the companionship of the students being there. They get a home safety evaluation. Things like that are important for them. But you know what the seniors say that they are most impressed with the program is just the opportunity to get to help train these future doctors, to help them know what does a senior adult want in their doctor.
Absolutely. I think it's such a unique opportunity for the student and such a wonderful opportunity for the senior to be able to have that partnership and that relationship for them to learn hands-on what is needed, how they want to be treated as well, which is so important for our aging community to be treated with a certain amount of respect.
Sure.
Absolutely.
Compassion, dignity, and respect, and just their future doctors learning to communicate with them, you know. Learning to talk in plain language with them. In medical school, you're taught all kind of technical terms, and so it's important that they learn in plain just language to speak to their patients, to share with them, this is what's important in order to make sure that you are aging well and that you are going to enjoy that, you know, that increased life expectancy that we have now.
And it's great to know, too, that they know that they're going to be listened to as well, and that what they're saying is being respected also. So I think it's a wonderful training program. I think that's a wonderful experience for them to have, to be able to partner together like that.
Yes.
Are you seeing a lot more interest in geriatric medicine?
You know, what we're seeing is that students are much more aware. And what we'd love is if we had hundreds of students who were signing up, wanting to be geriatricians, wanting to do a specialty. And I don't think the number of geriatricians will ever reach the number that we need. And so really our goal has been to teach that primary care physician or specialist who's going to be out there practicing to think in terms of this older adult. How do I need to communicate with them? What's important to them? What physical changes are they going through that are more unique to the aging adult? We have had more students who are being involved in our geriatrics programs, the opportunity to participate in some specialized programs. So we are seeing some increased interest.
That's good.
But our greater hope is that overall these students will have a better understanding of geriatrics as they go out into practice.
So for your physicians today, let's say someone is watching and they would like to get more information about making sure their practice is well equipped, who would they need to contact?
Well, certainly they could, locally they could contact us at the University of North Texas Health Science Center, but I would encourage them also to check, if they're in a different area, to check with the universities and medical schools in their state or in their area. We offer continuing medical education that's geared toward training practicing physicians to be able to understand these unique healthcare needs of the older adult.
Absolutely. Well, Dr. Farmer, thank you for coming and talking with us today and educating us and letting us know what you're doing with your Get It program. I think it's a wonderful program that you have, and it really shines a light on the importance of taking care of our aging loved ones. So thank you.
It's important.
Absolutely.
Thanks for having me.
Thank you. And thank you all for watching Joy in Our Town today.